All right, ladies and gentlemen, welcome back. Thank you very much for staying tuned to PTV World. You're definitely watching World this morning alongside Ms. Hajar Sati, and I happen to be Mr. Shahzad Hassan Khan. Ladies and gentlemen, earlier we were in conversation with Mr. Ziaul Hassan Saab, all the way from the United States of America, student of Aligarh University. And towards the end, he had quite a lot to say in his couplet. And ladies and gentlemen, whenever we talk about love, you know, there comes a lot of responsibility, but then there comes a lot of hurt as well. And God forbid if you hurt yourself, ladies and gentlemen, you know, I've seen a lot of people doing a lot of stupid things, probably drinking acid, God forbid, or probably, you know, harming themselves, or probably taking a lot of other medications in order to end their life just because they couldn't get love.
And apart from that, Shahzad, the kind of lives that we are leading, the lifestyles that we have, I think the health is very important and pertinent topic to talk about it, because I would say that we do not have a very healthy living style here.
Well, you know, I do because I always make sure to that, you know, I eat healthy, I go, I work out, I exercise, and that's our message for everybody out there as well. But God forbid, you know, if you have done something stupid as drinking acid because you were in love with somebody and they didn't really agree to, you know, giving their hand into your marriage. Ladies and gentlemen, we actually have somebody who's a hero. He does not wear a cape, but ladies and gentlemen, he's saved a lot of lives as well. God forbid, because, you know, over here in Pakistan, what happens is that this is something which has happened to me myself as well. So imagine, so I opened up the fridge, it was summers, it was really hot, and then there was this water bottle, and I drank, and because I was so thirsty, and all of a sudden I realized that it wasn't really water, it was something else, and I was like, oh my God, man, mother, why would you do that? So imagine, you know, kids going to different places, you know, they see a carbonated drink bottle, and, you know, there was something else which a mother would have put in, and then unfortunately, they're in great danger, ladies and gentlemen. So we're talking about corrosive intake surgeries today, and what are the treatments available, and how we really need to kind of follow it. Ladies and gentlemen, we're very lucky that we've actually been joined by somebody who's happened to be a chest surgeon. Not just that, he's worked for the major CMHs over here in Pakistan for the last 14 years, a thoracic surgeon as well. He's got the fellowship in general surgery in 2002. Ladies and gentlemen, he's a chest surgeon in Kulsum Hospital over here in Islamabad. He is Professor of Surgery, Brigadier Retired Asif Asghar Saab. Hello sir, Assalamu alaikum, good morning.
Wa alaikum assalam, thank you.
So thank you very much for joining us.
Right, so Brigadier Saab, thank you so much for coming on our show. First my question is, can you explain the chest surgery as a field of a surgery?
To start with, it is very pertinent to have an idea exactly about the chest surgery, because this is a relatively new subspecialty which has been started in Pakistan. Basically, chest surgery or thoracic surgery, this is a surgery of chest if you exclude heart. So it is surgery of the lungs, chest wall, food pipe, airway, all the disease related to these organs. This comes into the domain of a chest surgeon.
All right, so are we even talking about lungs as well?
Yeah.
All right. You know, so then unfortunately, because a lot of people have gone through COVID, I think it's very pertinent to talk about that as well. Do you think that a surgery can actually help your lungs get better?
You see, once a patient of COVID survives, and if he survives with some complication, and the most common complication after survival from COVID is lung fibrosis. You must have heard of it.
True.
And to be very honest, the exact treatment for lung fibrosis is a lung transplant, which is not exactly being done in Pakistan right now. So in future, we are seeing, foreseeing that probably the lung transplant will be the scenario.
Only
in
if you
Pakistan
get a donor, right?
Yeah. That is a quite complicated scenario.
And we need to, and thank you very much, sir, for saying that, because it raises this point, because I was in conversation with a friend of mine who actually needed a kidney, and we do not have donors over here, and we do not have that concept, and we seriously need to work towards that, where how, you know, God forbid, if anybody has got any terminal illness and they could totally donate their organs to somebody else who would certainly be living for a longer period of time. We need to think on these lines.
Right, and we also had legends like, you know, Edie, who donated his organs after the death. I think we need to popularize this concept over here. Yeah. So, sir, my question is that your topic title seems very interesting. Can you elaborate on that, from cup of essay to the cup of tea?
Yeah. I just wanted to make it a lighter note, because we are discussing a very serious disease, a very dreadful disease with lot of miseries. So I just wanted to make it light. And actually, this is a topic chosen from one of my patients. It is a story of my patient who I operated. She's a school teacher, 3 kids, married for last 12 years, and usually what happens is she had family issues, joint family, marital issues, and one fine day in aggression, she took a cup, put acid into that cup, and came in front of her husband and told him that I am taking this acid, and she just drank it. So after that, there was a series of events which she had to follow. She went to the hospital, not significant treatments. Then she ultimately was referred to a gastroenterologist, and all these treatments, repeated dilatations of her narrowed food pipe, this procedure went on for 1.5 years. And during these 1.5 years, she was not able to take even liquids by mouth. She just had one tube into her intestine from where she used to feed her. It was very painful. So she came to us, and we counseled her family, and then we operated her. It was a 6 hours surgery, complicated surgery, but alhamdulillah, ultimately she recovered. And the day we decided that to start her orally, to give something to her by mouth, and she took few sips of water, and then she told me that, doctor, I want to have a cup of tea.
Oh, that's very interesting.
So that was a very strange exclamation for us. But you see, if you realize that the month of Ramadan is coming, and by the time of Iftari, how do we feel about thirst and food? And it is only one day. If it is 2 days, 3 days, even 1 month, 3 months, you are not taking anything orally.
Exactly.
And if it goes on for 1.5 years, just imagine how that patient
And so then later on, did she realize that I shouldn't have drank the cup of acid?
Yeah. She now she has settled all her issues.
I think that's important. And ladies and gentlemen, it actually highlights the other part of the picture as well, where how we feel thirsty in one day. So imagine 1.5 years. So please make sure that you do not do anything stupid, and just because of the fact that nobody gave you that much importance to be around you, or God forbid if anything wrong did happen, please make sure that you ask from Allah Almighty, pray and relax and resolve and recognize all of those thoughts which come into your mind as well. But sir, in addition to that, when we talk about the treatment, because we have already registered now that it's because of that acid intake that can cause you problems. What do you do? Because that tube of yours is probably not going to work anymore. So do you figure out that that there's another tube which you're going to put in as a food tube as well, or what's going to happen with the esophagus or the stomach itself? What is the treatment?
First, I want to tell you that the word esophagus.
Yes.
So it is a medical word, and it's good to know. Actually, this is a very complicated surgery. Here, most of the patients, they have lost their esophagus, and usually the stomach is also lost. This acid goes that it just burns the stomach also. So what we are left with is a large intestine. We make a tube of large intestine, pull it up through the chest into the neck, and anastomose it to the throat. So this portion of the large intestine, we call it in medical terms a conduit. This works in place of food pipe, and this works okay.
It works fine.
Yeah.
But what about, sir, all of those gastric juices which are being produced within our own stomach to digest the food? So what happens with the digestion?
You see, that function is lost. But you see, Allah Ta'ala has blessed us with a lot of reserves and a lot of release. So it usually pulls on, and after 3 or 4 months of such kind of surgery, the people are taking normal food and they are leading a normal life.
Right. And sir, since you said the larger intestine needs to be pulled up till the time where we actually swallow the food. So then do we really have to do a lot of incision, or is it a keyhole surgery?
Yeah, this is a very interesting question.
Thank you, sir.
You see, almost 15 to 20 years before, when we were getting trained in thoracic surgery, all surgeries were big incisions.
Yeah.
And after that time, progressively, we have come up with the latest innovations and latest treatments. Right now, we are doing all keyhole surgery from the abdomen, from the chest. Wow. And what incision patient gets is only a 5 centimeter incision in the neck, where we anastomose this. And one point to be mentioned is that all this revolutionization of thoracic surgery in Pakistan, we owe this to our mentors at that time who
Would you mind naming some as well?
Yeah. in Pakistan Army, you see Pakistan Army has produced almost, I would say, 15 to 16 chest surgeons now.
Wow.
And this credit goes to our mentor and our teacher. It is Brigadier Sultan Sahab,
Right.
who has pioneered thoracic surgery in Army, and now you see so many thoracic surgeons in Pakistan.
Exactly.
It is
And so
because of
thank
his
you very much
efforts.
for joining us, because this is for the very first time in 9 long years that we were talking about thoracic surgery, and I never knew that such a surgery actually existed. You know, so I was like, God forbid, you know, people who have done this stupidity in their life are done and dusted. And usually, because I was in conversation with Dr. Saab off the record and before the show, and he said that it's with a lot of people with psychiatric disorders as well, psychiatric disorders and, you know, mental illnesses. They do exist, and we do not take them seriously, and that's how people fall into this trap as well. But sir, when we talk about the treatments or the management of such a case where we're talking about thoracic surgery, and till the time we make it to the surgery, what are the things which we really need to kind of understand that, hey, you know what, this is something which I need to do every single day to make sure that I'm going to survive? And then after the surgery, God forbid of such the cases, can there be any pitfalls, or can there be any other problems which people can come across?
You see, before I answer your questions, first I would like to highlight what is the existing scenario in Pakistan right now.
Okay, so sure.
You see, if some person takes such corrosive and goes to a public sector hospital, we have lot of deficiencies over there. We don't have, ideally we should have a thoracic surgeon available at the first point of contact, and he should plan his future surgeries, and also he should rule out that this patient is not having any life-threatening issue right now. He may be having perforation of his stomach, perforation of his esophagus because of this, if the amount taken is much more. So in that case, a chest surgeon has to be available there, and he has to operate it. The problem here is in public sector hospitals, we don't have much of the chest surgeons over in Pakistan. So sometimes these patients go unnoticed. They get admitted and they get unnoticed, and usually, to our horror, within 48 hours they die.
Right.
And if you see public sector hospital, there are a lot of mortalities because. Secondly, the deficiencies are in the late treatments. People do not know whether these patients require a thoracic surgeon or no. Even our GPs and general doctors, they don't know this. So the message to be conveyed is that a chest surgeon should be involved in such cases.
Exactly. And so thank you very much for saying that, because I would love to share it in Urdu as well, so that we, you know, the message reaches out as well. ख़वातीन और हज़रात, बहुत दफ़ा ऐसे होता है कि किसी जज्बातीपन की वजह से हम कोई ऐसी चीज़, एसिड या तेज़ाब या इसका इस्तेमाल कर लेते हैं अपने आप को नुकसान पहुंचाने के लिए, जिससे हमारी जो खाने की नाली है और पेट है वो जल जाता है, और फिर उसके बाद हमें नहीं पता होता कि हमने किस डॉक्टर के पास जाना है। तो ब्रिगेडियर साहब एक ऐसे डॉक्टर हैं जो अल्हम्दुलिल्लाह ट्रीट भी करते हैं। 14 साल मुख्तलिफ CMHs में भी इन्होंने सर्व किया है, अभी कुलसुम हॉस्पिटल में होते हैं। तो अगर आप लोग ढूंढ रहे हैं कि हमें किसके पास जाना था, तो आई थिंक ब्रिगेडियर साहब इज़ द राइट पर्सन। एंड फॉर एवरीबडी, you know, for our English speaking community out there and the viewers out there, ladies and gentlemen, God forbid, if you've had a corrosive injury, please make sure that you go to Brigadier Saab over here, because he happens to be working with the CMHs all over Pakistan for long 14 years as well. And not just that, he's working in Kulsum Hospital, so please make sure to find your way. But sir, very quickly towards the end, I was talking about the pitfalls. God forbid, any problem which we really need to know about after the surgery, which can occur and which can take place as well.
You see, if the surgery is good, recovery is good, there are not much of the problem.
Okay.
The patient usually suffers from some vitamin deficiency, like vitamin B12, which have to be given by injections or oral route. Rest, the patients are educated about how to swallow. Sometimes if you have burns in the throat, if you have a scarred throat, then you don't have a place to anastomose this colon over there. So in that case, sometimes people lose voice after surgery. So these are the important things.
Is it temporary or is it permanent?
Yeah, no. If in that case, if you don't have a place, then it is a permanent loss of voice. But my focus of surgery right now is that I always try to save the voice. And for that, it is a more complicated procedure. But usually, alhamdulillah, patients do eat normal food and they have a voice.
And we want to wish you best of luck, sir, as well for your future endeavors as well, because you're definitely saving a lot of lives and giving them peace and comfort. And that's something which they do want after, such a horrendous spell of their life as well. But thank you very much, Brigadier Retired Asif Asghar Sahab, for being with us. Lovely to be in conversation with you and keep on saving a lot of lives. Yeah, please make sure that you do that. And ladies and gentlemen, towards the end, I think it's about time that I allow my wonderful co-host over here to bid farewell to each and every one of you as well. So Hajra, please go ahead, take the lead.
Right. So we had a very interesting conversation today, and we had a very interesting cross-pollination of ideas, especially in our first segment, where we concentrated upon the social and intellectual landscape of ghazals and poetry and music industry. And in our second segment, Brigadier Saab enlightened us about the thoracic surgery and told us about a lot of, problems about the health problems. So it's a goodbye for now. Please write to us, because it feels really good you write to us. In this way we can feel your participation. And now over to you.
Exactly. So ladies and gentlemen, please make sure, as Hajra have requested to you all, that you really need to write to us, and we will definitely be back tomorrow in the morning as well. So please make sure that you look after yourselves. Stay tuned to PTV World, because our news anchor over here is on the hot seat and is ready to share the worldly updates with you all as well. So stay blessed. Good morning. Allah Hafiz. Thank you, sir.